So let's get into the next topic of discussion, which is healthcare. The question is, in what ways are healthcare policies affecting voter behavior in this election, or affected, of course, particularly given the ongoing debate over access and affordability? I don't know who to start.
I think I think often if you pay attention to the campaigns, you get this, I guess, this fake image that there's two polar opposites: completely socialized medicine that's packaged in red, and then completely privatized medicine which has an American flag, right? And they are both connected to these ideological sentiments, right, of the outsider and the American. But if you ask your normal student, so I ask this very often when we're talking about policy. I'll ask them, okay, if you're driving to school and you have an accident and you have to go to the hospital, should you be bankrupt to pay for that healthcare, right? And no one says yes, right? Everyone has a basic level of being no one should go poor for paying for healthcare, right? And everyone should have access to a doctor. These are just I think they're also very American values, right? This kind of traditional view, like Dr. Kirsi was saying, that there is a sense of social justice in this country, that we can all access it. But the way it's marketed is there's completely opposites, right? And I feel people are worried about this, but on one side you have the Trump campaign, who is basically talking just completely unscientific remarks that have really no backing and are not going to make the situation better. This idea of getting Kennedy to spear the Department of Health is to a point. I think it's just disrespectful. It's this idea of doctors and medical staff are really not trained and they really don't know what they're talking about, right? It's just a guessing game, and we can all do it, and so let's have Kennedy do it, right? But it's terribly dangerous for a country to do that, right? And on the other side, you have, I think, Kamala Harris, who doesn't seem to have a very coherent plan, but one of the things I like from her plan is that she at least will go to the very basic extent of having the federal government negotiate prices, medicine prices, which is so basic. This is not a remarkable idea. This is an idea that Mexico came up with 60 years ago, right? They didn't even came up with it, they copied it, right? So this idea of your medicines cannot just cost thousands upon thousands. It's just worldwide supported, right? And it's supported here too. And so they're very contrasting.
And I would add on to that the other thing that Harris does that, again, is far from revolutionary. I think America is, if they're not the last industrialized democracy to do this, they're certainly one of the last. But Medicaid and Medicare being used to cover long-term home care for seniors. I mean, that right there is something that I think would do a lot for the poor and the working class. Again, it's far from revolutionary.
Yes.
It's, as you correctly said, it's part of that bare minimum of simple decency, and again, catching up to the European countries that have done that for God knows how long. But it is something, I just wanted to add that on.
Yes.
Yeah, I think one of the things that shapes a lot of the conversations about healthcare in the U.S. is this conceptual distinction that I'm glad you didn't reproduce, which is the distinction between health insurance, between health and between health care, right? Yeah. Health insurance is totally unnecessary. What people need is health care. Health insurance is an entire industry, a multi-billion-dollar industry that does not need to exist at all, and only makes money. The entire business model is only conceptually possible by denying payments for health care, right? So I think to Carlos and Andrew's points, people need health care. I think long-term residential care for elderly people, both in-home and in facilities, is super important. But I think this issue, it gets at deeper questions that I do think hit on more kind of philosophical issues, right? That point that I just made about health insurance is a problem in a lot of insurance-based industries, right? There's this mediator, and it's a lot of profit making and profit seeking, not a lot of looking out for people. And in fairness, that's not. These companies have a legal obligation actually to maximize their profits, which means denying coverage for things. And this is where government needs to take a role. But when the insurance companies are the ones paying for the campaigns for the candidates, you end up with a situation where, despite the fact that Kamala Harris, I believe, was a co-sponsor of the Medicare for All bill that Senator Sanders introduced, she hasn't even mentioned, I don't even think, the public option this campaign, which is an even more moderate position than Medicare for All. And so I think she's banking a lot on just the fact that when Donald Trump talks about healthcare, everyone starts stocking up on prescription drugs and medications and bandages, and we're going to be in a post-apocalyptic situation because he talks so cavalierly and I think in a very kind of disrespectful way about medical professionals and the needs that people have, and it terrifies people. So she doesn't really have to take a strong position because he's terrifying, and I think that's really unfortunate because especially in a place like Texas where has the highest percentage of uninsured people, again partly by the governor's choice to not expand Medicaid, but even in states that have expanded Medicaid, there's still a lot of uninsured people or a risk of going bankrupt from needing medical care.
Yeah, I couldn't agree more. I think about Harris, especially her appearance on the Stephen Colbert show a few years ago, where she, in fairness, Colbert doesn't really ask hard questions anymore. Back in the day when he was pretending to be a conservative, he was often much more aggressive. But what's interesting is, he asked her specifically about her commitment to things like Medicare for All, which was a cherished position on the Democratic left at the time. Bernie Sanders was very sort of committed to it and still is, I believe. She sort of turned around and just sort of hand-waved it off as a point. She said, it was a debate, and he's like, but, you were committed to this. She's like, it was a debate, and you're kind of like, maybe this is the problem here, that people sort of almost are like saying the quiet part out loud right now about triangulating on this issue. And I know the other speakers have spoken very well to the actual sort of substance, but I just want to talk a little bit about the kind of how sad it is in some ways to see the coalition that was behind Medicare for All kind of dissipating this way. Now, the happy news, I suppose, is that Trump has sort of basically said that Obamacare, as it's known, is here to stay. He's not going to dismantle it. He's pretty much publicly said he's not going to do that. That said, to go back to Carlos's point about Kennedy Jr. Getting the sort of nod of the hat, the tip of the hat to head up some of the healthcare and the administration, healthcare policies. I think even that shows, we can debate RFK's in positions, generally speaking, but it shouldn't be forgotten that one of the reasons why RFK became popular in the first place was his very strident commitment to calling attention to the power of big money in healthcare. And it does sort of, it's not lost on me that we are still having that conversation. It's just interesting to me that the kind of coalition behind democratizing our healthcare, for want of a better term, is kind of shifting to the right. It's strange to me that that's happening.
Thank you. As a closing remark, I would like to ask you, can you, in your own words, say what needs to be improved concretely on the healthcare system for it to be better? I don't know who wants to start. Like a sentence.
I mean, I'll take the. I think we need to abolish the health insurance industry.
Absolutely.
And focus on providing health care to people.
Yeah.
Yeah, I wouldn't go that far. If we lived in a perfect world, of course.
Sure.
But I think a good start could be just like capping the ability of these companies to make a profit. Because I think one of the things of the United States is that there's this narrative that there has to be a profit for these companies to like be successful and make discoveries. But I think that has never been established, right? There's a lot of companies, medical companies in other countries that don't make that level of earnings. But they're still producing good quality medication or insuring people.
Sure.
Oh yeah, that's it.
Thank you.
So, abolish private insurance, cradle to grave, public insurance, an end to patents on medicine and medical devices. I think that's kind of piggybacking off of Carlos's point. And independent of any policy, and I realize that you can't really legislate morals, so to speak. I mean, we've tried that a million times and failed every time, but something that struck out was someone once said, we need better bedside manners. We need better care by doctors, and not just in terms of like getting rid of insurance, but we need better training for our doctors, and not just in medicine, but also in just raw care and compassion, particularly for those working with the elderly, working in hospices and so forth.
Thank you so much, Dr. Smith. Dr. Kersey?
Not much to add, just to back up or underscore some of the points that are made. I mean, it's worth keeping in mind that European outcomes in healthcare are generally considered better or superior in almost every single sense, yet they cost on a sort of a lifetime basis 20% less. Where does that money go? It just animates, I think, Professor Scholes' point that private insurance really is it's
a plague.
To paraphrase Matt Taibbi from a long time ago, it's a giant vampire squid stuck on the face of humanity.
Thank you so much. Thank you so much. Now we are currently at the half of the questions of the topics of discussion. Let's get into the next one, okay? Our next topic is gun policy, okay? Considering recent incidents of gun violence, how do you think public sentiment on gun policy will influence candidate support and the overall election outcomes?
This is something that to me is strange in two ways. Well, okay, one is not really strange, but so the one that is strange is the fact that both Trump and Harris are actually, at least in terms of on paper, pretty aligned with one another. The former president did at one time support expanding background checks, although eventually he did kind of back off of that, and so forth. But one thing that I find so interesting is the fact that most people, certainly young people that have now had to live in the post-Sandy Hook, Columbine eras, realize that there is we have a gun addiction. Just like Hunter S. Thompson, we have an addiction to guns in this country. But we're the addict that can admit that they have a problem, but they can't take that next step in treatment. They can't take that next step. I mean, we can't use the NRA as a boogeyman anymore. I mean, they're filing for bankruptcy. Their power is dissipated so much, and yet in some ways America has gone from somebody like Ronald Reagan, who, at least supported some gun control. I'm talking about as president. I'd rather not talk about him trying to strip the Black Panthers of their right to keep and bear arms, to now where there are so many people that believe that even increasing the time to buy a gun by, say, a day is the next step to, I've got a cousin that believes this, it's the next step towards CIA Black Hawk helicopters swooping down to your house, kicking the door in, shooting your dog, and stealing your guns. We have a gun problem in America. I think young people realize that the problem and are trying to do something about it. The problem is the older generation, I don't know what it is. They believe in the myth of the cowboy, the myth of the vigilante that we glorify as much as we revile it. And we just don't seem to be able to tackle this problem. We don't seem to be able to take that next step in our addiction to address it, whether public policy-wise or in terms of changing the culture, becoming more like Switzerland, where, you can buy a freaking machine gun, for heaven's sakes. And yet they don't have mass shootings because they understand that a purpose of a gun is to put food on the table and protect yourself. It's not there to make you pretend that you're Rambo or something like that. But in America, we just seem to believe that a gun is a toy.
Yes, yeah.
So I don't know if any of that made sense.
Yeah, I think it's interesting because I totally agree. There is a gun problem in the United States. When you have more guns than people, we could just start with that as a line. Once you cross that line, you now know you're in a problem territory. There's tons of data points that show that even this myth of self-protection is a myth, right? Most guns that people buy for self-protection, for protecting their family, get used accidentally or on purpose against themselves. So suicide is a big part of this, right? That's the number one, I believe it's the number one use of handgun death, or number one category of handgun deaths in the United States. But I also think if we have a society that has basically normalized children killing other children in school, the tool is only part of the problem, right? The gun is only part of the problem there. And so I think it does the problem, and you asked the question, recent incidents, right? But we can go back to, I was in middle school when Columbine happened, and it's been nonstop ever since, right? And after every really, really bad one, you hear people say like, well, if this isn't the last straw that's going to be the catalyst for change, then what possibly could be? You heard this a lot after Sandy Hook, right? Like the mass murder of small children by another child, right? And now some of these instances are committed by adults or people who are technically adults. But again, I think a culture, if you look at the recent Georgia case, right? The kid, I think, is 14 years old who committed that mass shooting, and they're prosecuting him as an adult. That is, I think, indicative of part of the problem as well. To think that a 14-year-old could understand the harm caused, and to treat this and punish them like an adult, this kind of punitive, there's a kind of violence to that, that I think reproduces this same type of logic. That's not dissimilar to, again, part of the logic that normalizes ideas like, how is the US government gonna lecture the American people about guns when we freely sell weapons all around the world and export violence everywhere, right? And if that's the role model for our society, is what our government does with guns, this is the exact outcome you would expect, right? And
Garbage in, garbage out.
Exactly, right?
I think there's two things I want to add there. When the Uvalde shooting happened, I think one of the big things of that shooting was that the police who arrived at the scene were so scared of the machine gun being used that they didn't actually intervene until very late. And I think that is a marker of a problem. When you have more than 10 police officers outside the door, but they're too scared to interact with the shooter because they don't have the equipment to go through it, and that thing is basically designed to go through body armor and all of those like bodily protections, you're gonna have that situation and where these things cannot be controlled, right? And I think that's kind of this is not completely related, but one of the things that has come up into the courts a few weeks ago is this case that now will go to the Supreme Court, and it's will Mexico be able to sue these weapon makers in the U.S. because these weapon makers are purposely allowing these weapons to go into Mexico, and it's such a problem. Not even the federal government in Mexico can solve this, right? These criminal groups are better armed than the army, right? And so you have this situation in where it's not, I think, just you really do have this industry completely out of control, and then you have what Bryant is saying, this situation in where we also have a healthcare situation, right? A healthcare problem. The kids who are committing these massacres, would probably still take violent action if the weapons weren't there, but the violent action wouldn't be that big, right? Because they would have like a knife, right? And we see other countries in where that happens, but the ability of them like to repel police is not there, right? And I think that when you mix those two things, free access to weapons, and then an increasing situation of healthcare, mental healthcare in the country, it's just very problematic, right? And I think like if you were to ask regular people, and this has come out in the polls, like regular Republicans will tell you, yes, there should be some minimum background checks, right? I would feel safer with them. It's not lack of public support. It's really, I think, it's lack of courage of our members of Congress to say like, okay, let me go out of my zone of comfort. Let me do something that might get me fired, and let me do it. But no, they're too cozy up to like whatever they get, all of their perks from being members of Congress, that they're not willing to take that step because they truly believe they'll be voted out, right? Which is very bad.
It's really hard to come up with any points that have not been already mentioned. I suppose I would just maybe say one very minor thing, which is that, I hope this isn't too biographical, but I was actually at Virginia Tech in 2007 when the shooting happened there. It's one of the largest school shootings in a U.S. history. So this is a topic that is dear to my heart, and I do want to see change. I want to see progress, but I feel, I'm not a citizen of the United States of America. I'm not from here originally. I come from a different country where gun control is not really questioned. There's nothing like the same. It's Ireland. There's nowhere near the same amount of guns on the streets, and that is a country with a history of armed violence, by the way. We should note. Living here over the years as a sort of and doing my PhD here and sort of learning about anthropology while living here, it sort of occurred to me that you really don't see political change until the people want it, and whatever change you can muster, you have to build it and base it on where people are at. It seems to me that part of the problem is that so many of the people who I would support in their desires for gun control are in the same breath doing other things in other policy areas which appear to condescend and to undermine the democratic wishes of many of the people who support access to guns. And I just wonder if a change of strategy could somehow be imagined whereby a maybe more bottom-up approach to this might be possible. It reminds me of Australia when it was the farmers themselves who had the guns, because Australia used to have very similar gun laws to the United States, and the movement to change that situation came from the bottom. It didn't come from the top, and it's just interesting to sort of think about how that example might translate over here.
Thank you so much. I guess that was your remarks on the topic. Thank you so much for them.